I reviewed the prior testimony of, I believe, 3 witnesses.
You understand there is no Demerol in the toxicology findings, correct?
Correct.
Did you read through the defendant's interview with the police?
I did not.
You didn't reference the defendant's statements about what took place or what type of care was being given as it might relate to drug addiction?
Objection. He's already testified. He didn't read the statement.
Overruled. You may answer it.
I did not.
Did you ask for it so you could make an informed decision here?
An informed decision with respect to what?
You tell me. Did you ask for the...
Well,
That's it.
it's argumentative. Re-ask, please.
Did you ask for the defendant's statement so you could evaluate his care as it relates to your area of expertise in addiction medicine?
No.
You were not interested in it?
I did not view that as pertinent to my expertise on opiate addiction, treatment, and withdrawal.
Well, how about benzodiazepine addiction, treatment, and withdrawal? Were you aware that Conrad Murray was having shipped lorazepam and midazolam to his girlfriend's apartment and was administrating it to Michael Jackson?
To relevance with regard to his opinion.
Overruled in view of the witness's statement about treatment. You may answer.
Rephrase, please.
Were you aware that Conrad Murray was having shipments of lorazepam and midazolam
Objection. Not that
sent to...
Please allow the entire question to be asked as we've discussed before interposing an objection. Finish your question, then I'll hear any objection.
Were you aware that Conrad Murray was having shipments of lorazepam and midazolam sent to his girlfriend's apartment and was subsequently administering those to Michael Jackson?
Objection mischaracterizes the evidence with regard to shipments of these particular drugs.
Overruled. You may answer it.
Please rephrase that
Yeah, that's
question.
the difficulty when we have long questions and long objections. This will be a complete question. The objection is overruled.
Dr. Waldman, were you aware that Conrad Murray was having shipments of lorazepam and midazolam sent to his girlfriend's apartment and subsequently administered lorazepam and midazolam to Michael Jackson?
I was aware that he was administering lorazepam and midazolam intravenously.
Were you aware of the shipments and the volume of drugs that were being sent?
No.
Did you inquire to learn about the volume of drugs, specifically lorazepam and midazolam, that was being sent to Conrad Murray at his girlfriend's apartment?
No.
You were not interested in that?
I don't think it was pertinent.
What are some of the symptoms of benzodiazepine withdrawal?
They're somewhat similar to opioid. Severe anxiety, increased heart rate, increased blood pressure, insomnia, restlessness, and in the worst case scenario, seizure.
They're almost identical to the symptoms of Demerol withdrawal, correct?
No, I wouldn't say almost.
Well, you listed...
They're different.
You listed for opioids at Demerol, I think, sweating, diarrhea, anxiety, insomnia, correct?
Correct.
Okay. You would agree that those are also all symptoms of benzodiazepine withdrawal?
Not diarrhea, not muscle aches and pains, generally not sweating.
So if there's literature supporting that those symptoms occur with benzodiazepine withdrawal, you would disagree with that?
There is tremendous crossover. There is tremendous idiosyncratic response. There is individual response. There are some patients who are going to have a mixture. You can differentiate them historically by interviewing.
By what?
By interviewing your patient.
Okay. So they can be quite similar, if not identical, correct, depending on the individual patient?
I would not say that they're identical.
No, that wasn't my question, sir. I said they can be identical or similar depending on the patient.
They can be similar. Similar is not identical.
And they can be sometimes indistinguishable depending on the patient, correct?
An inexperienced interviewer might not be able to distinguish the two.
Now, and I just want to be clear, is your opinion based on that Michael Jackson was at least dependent on Demerol, is that based strictly on the document from Dr. Klein's office, or is it with the other witness interviews? And I believe your words were publicly known behavior or something like that. Which is it? Is it based strictly on the documents alone that you offer that diagnosis, or is it more in total with witness statements, what you know from the public, et cetera?
I'm distinguishing between addiction, which is a behavior pattern, which we have some evidence for, but not a lot. I did not interview or examine the patient, or Mr. Jackson, versus dependence, for which we have substantial evidence.
Okay, let me repeat my question. Is your opinion, whether based on dependency or addiction, I want to know, is your opinion based on Dr. Klein's medical records alone, strictly the records, or does it also include the witness statements you said you reviewed and things you know from just what's out there in the public?
It's asked and answered, Judge.
Overruled. You may answer.
Again, my expert testimony with respect to dependence is based upon the record. My expert testimony with respect to addiction is based upon the record plus what's public record.
Okay, so as far as a diagnosis of addiction, Dr. Waldman, you would not, you would not be comfortable as a medical doctor diagnosing Michael Jackson as addicted based strictly on reading these pieces of paper in my hand. Is that a fair statement?
I would be highly suspicious.
Okay. You would not be comfortable diagnosing Michael Jackson as addicted to Demerol based strictly on these documents in my hand, correct?
You know, I would make a presumptive diagnosis, but as I would in any other patient who presented me data and for any other circumstance, but I would look for more evidence to prove or disprove that theory.
Would you diagnose Michael Jackson as addicted to Demerol based strictly on these documents?
I would diagnose him as physically dependent, and because the initial doses were high for somebody who may or may not have been opioid naive, it raises the specter and question of prior opioid use.
Let me try again. Dr. Waldman, would you diagnose Michael Jackson as addicted to Demerol based strictly on these documents in my hand, yes or no?
Probably not.
Thank you. Now, in order to give proper care as an addiction specialist, wouldn't you agree it's a tricky area, it's a specialized area of medical care?
Yes.
You need training,
You need experience.
and I think you referenced earlier that someone who's inexperienced might have problems distinguishing between, for example, different types of withdrawal.
Correct.
And there's certain kind of a level of care that you would give that begins with an interview and a complete history of the patient.
And physical.
And a physical examination, correct?
Correct.
Would that include urine testing potentially?
Sometimes.
It would include a complete history to determine if there are other prescribers giving drugs, other attempts at detox, any type of other underlying issues that could be ruled out as potential causes of addiction, correct?
It would be very comprehensive. You take all that history, you get a complete medication history, and again, remember, people who are coming to me with the problem are coming voluntarily, so usually there's no question. They provide you all the information. They don't withhold it.
But you want to get a complete medication history. Is that your words that you just used?
That's part of any good history and physical.
And in fact, what you've recounted here today regarding Dr. Klein's treatment is because you were provided a copy of Dr. Klein's medical records that were kept, correct?
Presumed medical records, correct.
Well, you're basing your testimony on these records. Are you saying these aren't medical records?
I don't know if they're complete.
Are you board certified in addiction medicine?
No.
What is dialysis?
Dialysis is a procedure unique most of the time to nephrology, by which somebody with kidney failure gets kidney replacement treatment. It's an artificial kidney.
And are you involved with dialysis?
I am.
And does that involve the actual process of doing that? It's you're removing. Can you just explain in simple terms the process of dialysis?
Sure. It's extracorporeal circulation through an artificial kidney. What that means in the most basic sense is you use catheters, needles, etc., to take someone's blood out of their body and run it through an artificial kidney.
And are
Mr. Waldman, you let me know when it's convenient to take a break at an appropriate point.
Thank you, Your Honor.
Thank you.
Does that involve the process of diffusion at all?
Yes.
And what is diffusion?
Diffusion is the movement of solutes in solution from one side of a membrane to another.
And those solutes move from a concentration, a greater concentration to a lesser concentration, correct?
They do, but they also move by a phenomenon known as solvent drag, which is not concentration dependent. And they also move dependent upon the characteristics of the membrane separating the two solutions.
Now, involved in the complete history then, let me just finish up this area, and then with addiction medicine, when you first meet the patient, then you're going to take a physical examination of the patient, correct?
Yes.
Get as much information from them regarding other medications being used or prescribed.
Yes.
You may order urine testing to confirm what drugs are being used, correct?
I generally do comprehensive laboratory and urine evaluation.
Okay. And that's kind of the level, that's the standard of care if you're going to be competently treating someone for addiction issues, right, is to get laboratory work to confirm in that initial meeting?
The laboratory, again, clients tell you what they're using because they want help. I'm not treating people against their will or who do not want help. And in addition to what you mentioned, I get permission to speak to other physicians, family particularly as well.
Thank you, but that wasn't my question. My question was the standard of care to competently treat an addict would involve getting urine results so you know through science you can confirm what the patient is receiving, correct?
I ask the patient, that's the best answer.
But you get urine results. Do you not believe them?
You didn't ask me what I get urine testing of.
Do
I do routine urinalysis. If I feel the need to do drug testing, I do it. But again,
when do you feel the need to do urine testing for drugs?
Just a moment. I'll allow Dr. Waldman to finish his answer. Go ahead, sir.
Thank you. As part of my comprehensive evaluation, I do routine laboratory testing. If I have reason to believe that the patient is being disingenuous, then I speak to family, friends, other physicians, if the patient gives me permission. And if I feel the need, I will drug test. I do not drug test everybody.
If you feel
when I treat patients in primary treatment facilities, they're urine tested on entry.
So you have that information right up front.
A few days.
And otherwise, if it's outpatient, if you feel the need, you'll pursue urine testing for drugs.
Absolutely.
And that's part of being a competent addiction specialist, correct?
I believe so.
Now, if a doctor is untrained in addiction medicine and senses that there are dependency or addiction issues, what they should do is consult with a specialist such as yourself, correct?
I believe so, unless they feel competent themselves in treating that problem. Many do.
But you didn't make an evaluation in that regard in this case because you weren't interested in looking at the defendant's statements, correct?
I reviewed the information